Good morning all. I am Mrs. Deepika Sri from the Department of Physician Assistant in Allied Health Science Institutions. So today I am going to explain about the fracture mechanism of injury in fractures. So which means mechanism of injury is the mode of injury, that is the mechanical part of the injury. They are mainly fall from the height. Okay, the three things is important. First one is injury, that means wound. Second one is repetitive stress. If because of some reason the bones getting very low density, for example after menopause of the women 45 years and more, they are getting a osteoporosis condition. It is one of the bone disorder. That means the calcium deposition and the density of the calcium become very low. That's why the bone getting brittle in stage. If we giving the more stress means the bone gets very brittle, and it is already the weakened bone. So it is the one type of the repetitive stress fracture. And another one is the pathological fracture. The pathological fracture is in depth. I am going to explain about both the three types of the fracture. The mechanism is mostly because of fall from the height. For building constructions work, like that the patient or bungee jump, in that areas the patients getting the fall, the risk of fall is there. So in case in that cases the fracture is occurred. Another one is RTA. RTA means road traffic accidents. Because of road traffic accident, the patient getting a injury in the bone. Another one is sports injury. The athletics are they are giving more strength to the bone. They are considered about their bone, but if not means the sports injury is there. Another one is occupational injury. Already I told for repetitive stress, for means the civil workers and prolonged standing workers like teachers, traffic police, doctors. In that cases they are getting the occupational injuries, or some injury because of the occupations. That means the if they are lifting a heavy items means because due to some reasons the weight is lifted by they are getting slip and it fall into their leg or somewhere. So that is the occupational injury. And then the injury is the direct force or indirect force, whatever it may be. In direct force, with the direct force the bone breaks at the point of the impact. The soft tissues are also damaged. That is the direct force. Another one is indirect force. That means the bone breaks at a distance from where the force is applied. If you are falling means we are trying to balancing our position by using a hand. If we are slipping our leg means floor. In the picture this is the guy is slept and he is giving balance to her posture by hand. That means this alternate radius getting fractured. So this is the indirect fracture. Some fractures patterns reveals the dominant mechanism. One is spiral pattern, that is twisting fracture. Another one is oblique, that is compressed fracture. Another one is triangular, that is bending fracture. And last one is transverse, that is the tension fracture. The fracture or stress fractures, that means occurs in normal bone, subject to repeated heavy loading, typically in athletes, dangerous or military personnel. Drug like steroids and methotrexate are some of the example for the stress and fatigue fracture. Because of prolonged running, the leg bone, that means femur getting a fracture. Another one is pathological fractures. In that inflammatory, that means because of osteomyelitis, that is because of some physical means disease conditions. That means osteomyelitis. Neoplastic means giant cell tumor, Ewing sarcoma. Secondary is miscellaneous bone condition, that means simple bone cyst and neurisomal bone cysts. Hereditary osteogenesis imperfecta, osteoporosis. Other acquired generalized disease like osteoporosis, osteomalacia and rickets. These are the pathological fracture. That means the pathological fracture means because of some medical condition the bone getting affected. That is the pathological fracture. Stress means because of repeatedly giving a more work to that particular bone means it getting the stress. Another one is fall injury. Fall injury, that is two types. One is direct, another one is indirect. So thank you.